Hello. My name is Jill Osborne from the Interstitial Cystitis Network. It is Sunday, June 18th. Happy Father's Day to all of the fathers out there. I hope that you guys are going to have some great time with your kids and happy Heavenly Father's Day to my dad. This is my first Father's Day without my dad. This is our normal, regular IC support group meeting. I'm back. After what has been the most painful month of my life. But I'm slowly getting into the groove. I can't promise I won't burst into tears at some point in time, but I am here. And for those of you who don't know, we were just dealing with the death of my parents, the sudden death of my parents. We had our funeral on Friday. And it went very well. Minister didn't show up, so guess who did it? Me. Spontaneously. I'm quite proud of myself, actually. It was a lovely military honors for my dad, bagpiper for my mom, and we can now rest. I'm very anxious to get back to my IC work because so much has happened in the last 2 months. So much that I want to share with you, so much that I need to study and that I need to listen to. We have so many new breakthroughs about IC that are going to change the face of how we assess and understand and treat IC. So there's very good things. Hello, Sylviane. Hello, Carol. We are simulcasting right now. We're live on Facebook. We're also live on YouTube. And I know it's Father's Day and we might not have a lot of people in, and that's okay. But I did want to give you a little bit of an update. So let me introduce myself. I'm the president and founder of the Interstitial Cystitis Network. I've been diagnosed with IC in 1992. Very severe pain patient for many years, and pain-free now. And that's we're gonna talk a little bit about that. The National IC Support Group leader. I have a bunch of college degrees in chemistry and pharmacology and all that sort of stuff. But ultimately, in the end, I am a support group leader, and I'm your support group leader, and I want to do everything that I can to support and encourage you, to educate you, to motivate you, to give you some new ideas to help you break some patterns which might be making your IC a little bit worse, et cetera, right? That's my job, and I'm happy to do it. If you're looking for more information on IC, you can always go over on our website, icnetwork.org. Lots of big things happening. So normally when I do these meetings, I do a little 30-minute intro and then we take your questions. But something I think is really stunning me right now. So I got COVID a month ago and it wasn't that bad. And then the reason why I didn't do my meeting last week is because I had oral surgery. I had 2 dental implants. And I came back with a sore throat. Worst cold of my life last week. I'm still very congested. The coughing was so bad, I couldn't breathe. I was like literally begging my doctor for cough syrup on Wednesday so that I could get through my parent service. I haven't had a cold like this since I was a kid. I mean, this is ridiculous, as you can see. So one of the things that I naturally turn to because I had such a bad sore throat is this. You know what this is? This is lemonade. I have drunk 3 gallons of lemonade in 10 days. I've had hot lemonade with Manuka honey. I've had cold lemonade. This is dilute lemonade, but it's lemonade. So this is my question for you. How the hell can an IC patient drink lemonade? Hi, Kayleen. I haven't had lemonade in decades. The number of times I had agonizing flares drinking lemonade and cranberry are off the charts, right? You have to understand, I was homebound. I couldn't sit in a car without crying. And one of the reasons why I cared so long for my parents is because they cared so much for me when my IC was so bad in my early 30s. would never have dawned on me I can remember once drinking limeade and having an agonizing flare. And literally, honestly, I have not had lemonade in 30 freaking years. How on earth could I drink 3 gallons of lemonade and not have an icy flare? It's amazing to me. It's absolutely amazing to me because there's no doubt that I am an IC patient, but I am a different subtype. So you have to remember that we now understand that there's very, very clear diversity in the IC patient population, right? For some of us, IC begins in childhood. For others, IC begins after menopause. For some of us, IC begins after having a baby, while for others, IC begins after going through chemotherapy. Yes, we all have this name, interstitial cystitis. Sylviane said lemonade scary. I know, right? It's crazy. So we have this tremendous diversity in this patient population. And so our second question then is show, so what are we looking at generally with respect to our diversity here? Well, we know very clearly that there's a group of patients who are absolutely pelvic floor driven. They don't respond to bladder therapy. Or they might get a little bit better, but they're always flaring. There are a group of patients who have pain on bladder fill. The fuller you get, the worse you feel, and it's agony. So if your pain gets worse as your bladder fills with urine and you feel better once you empty your bladder, well, that's telling us your bladder wall is involved. There's a group of patients who don't have pain on bladder fill, but they have a lot of urethral pain, they have a lot of vaginal pain. There's a group of patients who have Hunner's lesions. Hunner's lesions are open wounds in the bladder. I mean, if you've got Hunner's lesions, you're not going to touch lemonade with a 10-foot pole. Now, we've looked in my bladder. I have a normal, healthy bladder. So how can I have a normal, healthy bladder and yet still have agonizing pelvic pain? Well, ultimately, it begins with what triggered my symptoms. So my symptoms began at the age of 13 in junior high. I couldn't sit through class. The teachers were pissed off. Jill, they call my parents. Jill can't sit through class. She's got a bladder problem. Take her to the doctor. They took me to the doctor. The doctor went, she must have an infection. Gave me 16 sulfas to swallow at that appointment. I remember sitting there. Right? I was also diagnosed with a urethral stricture. So what does that mean? It means that my urethra had become very, very narrow. It was like trying to pee through a needle. And their answer back then, of course, was to open it up with a metal sound. We call it a urethral dilator. So I endured about 100 urethral dilations through junior high and through high school. Nobody ever asked, gee, why is her urethra narrow? No one ever asked that question. And then, of course, because something was very clearly wrong, and I'll tell you what began it. I broke my tailbone. I broke my tailbone that summer. Okay, that was my triggering event. Why was my urethra narrow? My urethra was narrow because my pelvic floor muscles were badly affected by my fall and me breaking the tailbone. But of course, we had no idea that played any role at all. We had no idea. So here I have this long-term injury. I literally could move a piece of my tailbone around for years. It was just floating in there. And other things started to happen. So in high school, I developed vulvodynia. And of course, back then we're going, well, it must be candida. You should invest in Monistat. Dozens and dozens of prescriptions of Monistat over the years. Nothing worked, right? And then I developed IBS. my early 20s. And then I developed migraines. And then I developed super, super, super sensitive skin, like way off the chart sensitive skin. And then bladder pain happened when I was 32. I'd never really had pain on bladder fill before. So I didn't have a normal life like most people did. I was sick. It felt like I was sick. Of course, now we know it was injury or trauma, or trauma, right? That I had a pretty significant injury to my tailbone and my pelvic floor. So by the time I was 32, I had pain on bladder fill. And it wasn't little pain. It was me begging my doctor to remove my bladder. True story. I went and I begged him to. I couldn't sleep. I was laying on the living room floor most nights, huddled in the fetal position, rolling back and forth, begging God to take me. I'm not lying. That's how bad it was. It felt like I had razor blades going up and down my bladder wall for years. Got the diagnosis of interstitial cystitis, did DMSO, didn't work. Did lots of antidepressants, didn't work. Every bladder therapy failed. And before I knew it, my 30s were consumed by icy pain and me feeling quite sorry for myself. I legitimately should have. I mean, listen, you feel like your life is destroyed. And then something remarkable happened. Hi, Ann. Hi, Paula. Hi, Sylviane. Hi, Kayleen. Something remarkable happened. Back in 2008, a physical therapist came forward and said, "Hey, have you looked at the muscles?" And the doctors laughed at her. I was at the conference. It was a National Institutes of Health IC conference in Minneapolis. They laughed at her. They walked out of the room. She was given the last speaking event of the night. Her name was Rada Caterino, so like after 5 o'clock. Almost everybody walked out of the room before she even began. They absolutely laughed at her. And she came to report that, you keep describing tight muscles. All your articles describe tight muscles so tight they resemble tight piano strings. So have you ever considered working with the muscles? And again, they all kind of chuckled. Oh, she don't know what the hell she's talking about, all this sort of stuff, right? But her data and her experience was very compelling. It was really working in her clinic that some patients with IC who had pelvic floor physical therapy got remarkably better. And so that triggered a very large clinical trial that was funded by the National Institutes of Health. And she actually wasn't 2008, it was probably 2005 when she came forward. Anyway, the National Institutes of Health funded an IC pelvic floor physical therapy study. And when that data came back, the data was stunning. Stunning. The pelvic floor physical therapy outperformed every other bladder treatment 2-to-1, right? Ravonda, yeah, and definitely, and I'll get back to that. So, so doctors, some of the top doctors started sending their patients to have a pelvic floor assessment. And the doctors started to learn the signs of tight pelvic floor muscles. Feels like painful beef jerky. It's very tight and taut. Obvious. If a patient can't start their urine stream right away, if you hesitate before you urinate, your muscles are involved. You know that flare you get when you're driving, that flare you get after having sex? That's a muscle flare. Yeah, it feels like your bladder, but it is a muscle flare. So when this big clinical trial came out, it showed the pelvic floor physical therapy was stunningly successful. The entire IC world was turned on its head, and everybody went, wait. All this time, we've been going bladder, 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 but what? How can it be a bladder problem if pelvic floor physical therapy works? Maybe there's a muscle problem going on. Maybe there's a muscle problem. And new research now shows that 85 to 90% of IC patients have a muscle problem. So, what do tight muscles do? Let's look at the physical reality of a tight pelvic floor muscle. You know, when you think about your pelvis, it's the center of your human body, right? I mean, it carries the weight of your torso. It deflects the stress or absorbs the stresses and pressures of you walking. It's a small area between your hips where there's a lot of stuff going on. We got all your organs. We got your urinary tract. We got your gastrointestinal system. We got your reproductive organs. We've got some ginormous blood vessels, like your femoral artery. We've got some ginormous nerves that go down through the pelvis and go down both legs, like the sciatic nerve. So nothing operates in isolation in the pelvic cavity. It's impossible. They influence each other. And that was something that Jerome Weiss really reinforces in his book, Breaking Through Chronic Pelvic Pain. Doctors like to play in their sandbox. Urologists like to stay in the urinary tract, gastroenterologists in the gut, et cetera, et cetera. And that's a fundamental mistake because nothing operates in isolation. So we know, for example, that if you have a really severe bladder infection, your muscles are going to get tight in a guarding reflex to protect you from that pain. You cannot control that. That is just how your body defends itself from pain. So we know that organs can change the way that muscles behave. It's called the viscerosomatic reflex. But the far more important question is, can muscles change the way that organs behave? And the answer is absolutely. Because if you have tight muscles, those muscles will change blood supply. They will they will squeeze blood vessels and make it very difficult for a good, healthy supply of blood to reach your bladder, to reach your vulva, et cetera, et cetera. If your bladder is supposed to get 24 units of blood a day and it's only getting 10 because your muscles are so freaking tight, are you going to have a healthy bladder? No, you will not have a healthy bladder because it is being deprived of oxygen and deprived of nutrition. So getting back to my question, okay, there is no doubt in my 30s, I could never have drunk lemonade. Let's go back in time. So I suffered a severe pelvic injury. My muscles got very, very tight. And over time, because I had no freaking idea I had a pelvic floor injury, my muscles got tighter and tighter and tighter and tighter. And then they started restricting blood supply. And reducing blood supply now starts affecting nerves. So now I've got nerves that are very irritated. And then inflammation begins, right? And we can see that with the progression of the frequency urgency to the vulvodynia to the IBS and eventually to the bladder pain. So by the time I was in my 30s, my bladder wall was toast. But why didn't bladder therapies help me? Because it was never my bladder wall as the source of the problem. It was all about blood supply. My bladder was just being starved of blood supply. That is called ischemia. ischemia, ischemia. So why was my bladder so messed up? Because it was being starved of oxygen and nutrition. Why was I diet sensitive? Because my bladder wall was damaged. It was in bad shape. It was in bad health because it was being deprived of oxygen and nutrition. Why couldn't I drink cranberry juice or lemonade? Because I had terrible blood supply. And so it's absolutely stunning to me, given the fact that I trained myself for over 30 years to never drink cranberry or anything like that. And here in the face, for those of you who've come in late, terrible cold. Terrible. Like COVID negative, but I was convinced it was COVID. And I had no choice. I couldn't talk. I started drinking hot lemonade with honey. No flare. No flare. I literally, this is my second today. My bladder's perfectly fine. Why? Because you know what? My muscles are fine now. My muscles have been fine for years now. I have good blood supply to my bladder. My bladder is healthy. We know it's healthy because we looked at it when I had my hysterectomy. And even with a little bit of estrogen atrophy going on, that's not affecting my bladder. So, my mind has really been blown by this. I mean, it's just like, oh my God, Jill, you're drinking lemonade for the first time in decades and it's not hurting you at all. Why? Because my muscles are in shape. Now, another thing I want you to think about is we had another research study that came out a couple months ago where they were correlating, because now all of our research is looking at it based upon subtype, and it's so good. So many good things are happening. And so this was a MAP Research Network study where they were just really trying to understand what symptoms are associated with what subtype or phenotype. And in their research study, what was absolutely amazing is that the symptom of frequency urgency most commonly associated with pelvic floor muscles rather than a bladder wall dysfunction, which is, you think of that's counterintuitive. That makes absolutely no sense. But again, with the effect of ischemia and oxygen deprivation, it does make more sense. So my point in talking about this is if you've been doing bladder therapies for years and they're not working and you're still flaring, our guidelines say, the national guidelines say, stop what you're doing, take a step back and revisit the diagnosis. Because if bladder therapies are not working for you, then maybe there's something else going on besides your bladder wall. Maybe the problem with your bladder wall is being caused by something else, like your pelvic floor. And now, with a patient who is being newly diagnosed, based upon our national guidelines, literally one of the very first things that a urologist is supposed to do in that initial examination is to check the pelvic floor. And if the pelvic floor muscles are tight, they are to be immediately referred to pelvic floor physical therapy. Immediately. Because we know physical therapy works. And think about what would happen to me if I could have had physical therapy when I was 13 years old. None of the other stuff would have happened. I probably would be married with a bunch of kids. No doubt about it. But instead, I spent my 20s and 30s crying in pain because no one suspected that my muscles were involved. And so it's really an amazing blessing that at the age of 62, I am pain-free. Now, I will say, going through the death of my parents, it's the single hardest thing that's ever happened to me, my sister and I. It's been agony. And then getting COVID from the hospital didn't help. And I was kind of laughing, going, I need to be the case study of what happens to quote unquote IC during a period of very, very severe stress. And I did have 3 flares. And they were really interesting flares because literally I was you know, doing whatever I needed to do. It's just kind of all a blur for me right now. And I was trying to walk every now and then, but lots and lots of crying, et cetera, et cetera. And 3 separate times, I had a very sudden flare. I was peeing every 5 minutes. It felt like I had a yeast infection. In fact, the first symptom was pain at the vaginal introitus right at the entrance of my vagina. So I'm like going, okay, yeast infection, yeast infection. I've been drinking 7-Up. I never drink 7-Up. Been eating that in the hospital. Okay, so it's a yeast infection. It wasn't. And it progressed a bit. And then before I knew it, I needed to pee every 5 minutes. But what I was able to see is that when I went to pee, I couldn't pee right. I couldn't start my stream right away, which is the number one sign that your muscles are a problem. The way for you to check in on your pelvic floor health is to just go to the bathroom and look at your ability to urinate. If you cannot empty your bladder easily, if you cannot start your stream, your muscles are freaking tight. They're tight. And I saw that immediately when I went to the bathroom. So what I do, I went and got my wand, dropped trowel, went in my bathroom, did a little internal pelvic floor work. Yes, my muscles were extremely painful to touch. Did my massage 5-10 minutes, went away. 10 minutes later, it was gone. And that happened 3 times in a row. I mean, I didn't waste my time doing bladder stuff because I knew it wasn't my bladder. I knew it was my pelvic floor. So, if you're not responding to bladder therapies, if you're getting worse rather than better, we must take a step back. Now, some of you are your own worst enemy. You're your own worst enemy because, you go to physical therapy, they do the internal work, it hurt the first time. When you have your pelvic floor assessment, all they're going to do is touch muscles. And if they can touch a muscle and trigger pain, woo, baby, that's your hallelujah moment. That's it. What are you touching? But some of you have gotten scared by that. You don't want it. It's like, I'm not doing internal work. Are you kidding? That hurts like heck. I'm not going to do it. That is exactly the wrong thing to do. Because if it hurts, it means they found it. And the thing is that as you slowly work those muscles, the pain goes away. If you ignore it and you just want to take an Elmeron every day or a pill every day, you're never going to get better. We have to restore a blood supply. That is the fundamental priority of somebody with tight pelvic floor muscles. As long as your muscles are tight, your bladder is going to be screwed. So having a proper pelvic floor assessment, I was working with a patient a couple weeks ago, and, just classic situation, diagnosed 10 years ago, had all the treatments, all the installations, considering doing InterStim. I'm trying to remember. She had never had a pelvic floor assessment, never. And we go through the symptoms: can't start your urine stream, pain with intimacy, pain while sitting, pain with movement. Listen, if your pain changes as you move, that's your muscles. That's not your bladder. The bladder does not change. Bladder pain does not change with you sitting or standing or going up a flight of stairs. Or if you have pain on the left side or the right side, that's your pelvic floor. And she was gobsmacked. It's like, what? Nobody ever told me about the pelvic floor, and here she's considering having surgery. And the thing is that surgery patients who've gotten neuromodulation, probably the vast majority of them, although I haven't looked at the research recently. I mean, it's not FDA approved for IC, so that tells you the data is not good for IC. And yet thousands of patients have had it done. Are they better? Some of you are, and some of you aren't. So I'm really excited for the next year or two. I think that, so as an example, at my meeting a couple weeks ago, hi Donna, thank you for your card, Donna, that was very sweet. We had Dr. Ann Ackerman from UCLA talking about the microbiome, because, a lot of you're like going, well, I'm sorry, it feels like an infection. It's got to be an infection. Treat me for an infection. Give me antibiotics for an infection. And yet, when we do our biome studies, our urobiome studies, the IC biome is normal. A little bit less diverse, a little bit more lactobacillus. Lactobacillus is good bacteria, so what's the point? What's the problem? You know, they were all hoping for a smoking gun. They were hoping that they could find Helicobacter pylori, which is the bacteria that causes stomach ulcers. They were all hoping we'd find this crazy Helicobacter, something like Helicobacter pylori. Here, hold on. There's that tonsil. And I'm telling you, once that tonsil starts to tingle, bad things happen. I start to cough, so bear with me here. Okay, what was I saying here? Well, I got to get back to what I was saying, because the tonsil tingling stops me in my tracks every single time. Okay, so Ann Ackerman, UCLA, again, is taking a second look at the biome, because so many of you are convinced it's infection. There's a very, very strong component of patients out there who believe it's infection. So she did the biome studies and she broke it up by subtype. And the patients who were pelvic floor driven had an absolutely normal subtype. I mean, normal biome. There were no weirdness with bacteria, beneficial or pathogenic at all. Now, what she found in her study of young women is that women who had pain on fill, or men who had pain on bladder fill, had an overabundance of lactobacillus. But of course, lactobacillus is good bacteria, right? Why would we be concerned about lactobacillus? Whenever you take antibiotics, you get lactobacillus acidophilus to try to restore your biome, right? Why would we worry about lactobacillus? Well, she's the first researcher to look specific, and there's lots of different types of lactobacillus. She looked at that, and she did make a fairly remarkable discovery that women under the age of 45 who had pain on bladder fill had an overabundance of the lactobacillus iners, I-N-E-R-S, iners. That's actually a pathogenic lactobacillus. So it does not kill candida. It does not do the job that other lactobacillus do, and it also damages the bladder wall. So that's some new emerging research. I had no role in my symptoms, but that could have a role in some patients' symptoms. So we will have more on that anyway. So the good news, we're not thinking of IC as an incurable bladder disease anymore. We have gotten much greater insight into the things that can cause IC, and et cetera, et cetera. So let me go ahead. Hi, PK. Let me go ahead and take your questions. Rhonda says, I'm sorry for your loss. Thank you, hon, Rhonda. I'm not crying for hours anymore. I just kind of randomly burst into tears every now and then. Sandy said, I always seem to need this reminder. Yeah, we all do. All right. So I'm doing better, except for this cold. Sylviane says, lemonade is scary. I know. It used to be scary for me, too. I was freaking desperate. I can drink lemonade now, no problems at all. Because my pelvic floor is healthy and my bladder wall is healthy now. Let's see here. So hi, Paula. Hi, Ann. Hi, Diane. Hi, Aaron. Aaron says we missed you. I know. I missed you guys too. Very, very much. I'm very excited now. You know, my world had gotten very small, especially in the last year. And I was barely able to work because my parents were always needing me to do enemas and you name it. I did all of their medical care. And I can breathe now. I mean, I got up at 7 this morning. I watered my garden. I went for a walk and I came home and I started catching up on my IC reading. And I've got so many things that we're going to do in the coming months and the coming year. And I know that my parents are both saying, do it, Jill, come on. My dad is saying, do it. My mom is saying, we believe in you, keep doing it. and I'm going to do it. This is my cause. Rabonda says, do I think the trauma of my neighbor also had impact on my anxiety and fight or flight? Yes, it did. So if we contemplate what happens after a physical injury, nerves get damaged. Okay, and damaged nerves cause chaos. So you might have a damaged nerve down in your pelvis, and then because that nerve is continuing to be damaged because of tight muscles and reduced blood supply, that neuroinflammation is going to spread to the spine. It's going to come from the spine up to the brain, and then you're going to have massive anxiety disorder, which I certainly had in my 20s and 30s. And so, and you know, it's very weird being in the house alone again. And so I'm having just a little tiny bit of anxiety about that after so many years of not being alone. But, it's okay. It's okay. So that natural progression to anxiety disorder is easily explainable after a major physical injury and pain. I mean, we know that 14 days of pain, 20 days of abuse are going to trigger this whole chronic fight or flight. And of course, I had the extra difficulty dealing with somebody in my neighborhood who was very violent, and I was one of his early victims who eventually became a rapist and a murderer. And I did not leave my home without fear because of that. So that also played a role in my symptoms. There's no doubt about that. Annie says, even a bladder with Hunner's lesions can develop pelvic problems. Well, it's the chicken or the egg. For us, a lot of it is which comes first, the bladder or the pelvic floor. For some of us, it begins with a bladder wall issue. And so we got to address the bladder wall issue like chemotherapy or drinking way too much diet soda, because the bladder will be hurt by chemicals. And for others, it begins with a muscle trauma, and then the muscles become so messed up, the bladder then gets messed up. Hunner's lesions are kind of one of the great mysteries, but they're not really so much a mystery anymore. We now know that lesions can be the result of nerves that are very, very inflamed. So going back to tight pelvic floor muscles and trauma, or having something called posterior fornix syndrome, where you've got a uterus that's free swinging and the nerves are getting messed up that way. And when we restore the proper position of the uterus, the Hunner's lesions go away. So that's one potential cause of a Hunner's lesion. Another potential cause of a Hunner's lesion are viral infections. Eddie here says, I've had IC for over 20 years and I'm now suffering with long COVID flare-ups over my body. Any advice? So number one, Eddie, you're not alone. The IC Network, we're the only group that has studied IC and COVID extensively. We have a research study going on right now in our survey center. This is what we know is that 75% of IC patients who get COVID report flaring. And of those, 25% report an extremely severe agonizing flare that does not respond to typical flare management strategies. What the research shows, the research was first done in Germany. It was replicated at Beaumont, or in Detroit, at the University of Michigan, Beaumont Health in Michigan. They also confirmed a lot of this data with bladder wall irritation and COVID. What the data shows is that it's finite. It doesn't appear to be long term. That the vast majority of IC patients who flare with COVID report that 9 months later, a year later, things calm down. Now, and the bladder goes back to its normal. But still here, Eddie, the COVID sucks, the long COVID sucks, but we still have to try to figure out what phenotype you're in, because if you continue to have extremely tight muscles, that could explain why you're not getting better over time. It's easy to blame it all on long COVID when we want to make sure we try to get down to the utter basics of your case, and that is your phenotype. Christine says, how do you find a pelvic floor physical therapist that understands IC? You go to a website called pelvicrehab.com. Pelvic Rehab, short for rehabilitation. Pelvicrehab.com. Let me put this in here. There's your database, hon. Just go right in there. You're looking for a physical therapist who has been trained by the Herman Wallace Institute in pelvic floor issues. Everybody listed at pelvicrehab.com has some training, and quite a few patients are now physical therapists are now completely certified in pelvic floor and pelvic pain conditions. So here, that didn't work. Hold on. Let me put the full. Is that going to give us a link? There you go. Now we have a link there. So just search by zip code, and the link, the little droplets that are in gray are physical therapists who have some training. The droplets in yellow are the ones who have the complete training. They're certified. If you go to a physical therapist who tells you to do Kegels and refuses to do internal work, because the most important way of working with the pelvic floor is internally. Let me get my model here. Stay. Okay. And I just want to show you why internal work is by far the most effective. And you know, I got to do something here. I got to brighten up my screen on this computer. There you go. That's better. Okay, pelvis, inside, pelvic muscles. Look at these muscles, right? You see how they're flat on the bone? The single most effective way of getting to these muscles is with a finger, gently massaging these muscles. They tend to follow the length of the muscle. Do you see that? That's what I do when I do my internal work with a wand. Sometimes they go across, they call it strumming. Sometimes they will push if you have a trigger point. But generally, you can see that a finger is absolutely the most effective way working with this muscle. So if you have a physical therapist who is not doing internal work, I would want to know why. And listen, I understand that for some people, the thought of doing internal work is disgusting, especially if you've been a victim of abuse or if you've been raped. Tell them that. Tell them that, because they, you know, every physical therapist I've worked with has been absolutely wonderful, from Lisa Icavelli here in Marin County to another one, I can't remember her name, and my most recent one that I worked with for years, her name is Pam. They are just so kind and insightful and practical. And they take any of the shame or blame away from this, especially Pam. She's been amazing to me. And so if you have an issue that's affecting your ability to have an internal exam, they can start externally. They're going to look for tension patterns in your thighs, in your back, in your core. And some of you have muscles so tight you couldn't get a finger up there even if you'd like to. You're just locked down as hard as you possibly can be. That's called vaginismus. And so in cases like that, they go very, very slowly. They might not try to do internal work for 6 months. Part of it is just rebuilding your trust. Part of this is helping you understand that your body likes physical manipulation, whether it's a massage, whether in your leg or your back, that touch has healing. And they can just slowly and steadily work from the outside in. But our goal is to try to get into those internal muscles eventually to see what we can do to restore their health. You're welcome, Christine. You're welcome. Anne says, what can be done for incomplete stool emptying? So one of the classic symptoms of tight pelvic floor muscles is constipation. One of the symptoms of somebody with pelvic floor dysfunction is not being able to have a normal bowel movement. I didn't have normal bowel movements for years, and they were so painful in my 20s. I called them bend over and screamers. And of course, we didn't make the connection, tight pelvic floor muscles, pelvic floor injury back then. And now I have completely normal bowel movements because my muscles are now restored and in much, much better health. There can be neurological issues affecting your ability to empty your bowel. I will tell you that my mother, here, hold on a sec. So my mom, I'm not lying at all. Cleaning out my mom's stuff, I found journal after journal after journal of bowel movements. It was very important to her, but it never ended. Last 6 months, she'd have a bowel movement. Did you write it down? Because she couldn't clean her up herself afterwards. I was intimately involved in her bowel movements. And I kept saying, Mom, why are we tracking this? It's fine. You're having bowel movements every day. It was really, really important to her. So in going through her things, what was so interesting is that she had terrible vulvodynia when I had terrible IC that coincided with I was 32. She was 30 when I was born, or 28 when I was born. So she had gone through menopause and just started developing all this pelvic pain, right? And I found these heartbreaking diaries. I mean, it's amazing that her story matches the story of the vast majority of us. I have a puzzling condition that's persisted off and on for a number of years. I think now, this is her diary. I think now that it may have begun shortly after I began estrogen therapy. For a long time, it was minor, but over years, it escalated to become very strong, intense, acid burning sensation in the vagina. One of the puzzling aspects of this condition is that it comes and goes. I actually had no flare-ups from 91 to 92, and it is also worse when I'm sitting or lying down. And I'm reading these going, okay, what was going on with her back then? I know that she soaked in a bathtub for decades. Every day. And now that I'm reading it, she never showed any of this to me before. She was in agony. So at the bitter end, this is how she had a bowel movement. And I'm not lying. I think it's important we do this. She would bend over and then she would do this. Bend over, do this. And I caught her. I caught her doing this. And I was like, what are you doing? She was sitting on her commode doing this crazy movement to try to have a bowel movement, which helped me understand why we had poop in front of the toilet. For years, there'd be little pieces here and there, like, what the hell is that? Her pelvic floor was toast. It was toast. And she could not have normal bowel movements. She had to strain and strain and strain and take Dulcolax or have an enema. And I wish we could go back in time 20 years and given her a pelvic floor assessment. Those issues with bowel, I'm so grateful that she never has to worry about that again. She doesn't. It's over. And yes, would she be happy that I'm sharing this? Not particularly, but she was also a teacher and she knows it's important to teach. And so if you're straining to have bowel movements, if you're contorting your body to have bowel movements, honey, you got to get your muscles checked, because she suffered for decades. She had 3 babies. I was her last baby. I was a ginormous baby. So she probably had a birth injury from 1, 2, or 3 of her babies, low grade pelvic floor tension, and things just amplified after menopause. Carol says, let's see, Diane's here. Hold on. Diane says, can pelvic floor problems cause the bladder wall to be inflamed? Yes, exactly. Because if your muscles are tight, there's restricting blood supply, which is causing your bladder wall to break down. Now you have a leaky bladder wall, urine's getting inside your bladder wall, causing inflammation. Yes. Carol says, having a lot of pain lower left abdomen, and the doctor said he does not know why. It's been going on for years. All of a sudden, the pain left on the left side of my thigh hurts when I walk. He wants me to do an MRI on my spine. I'm still thinking it's part of IC. It's pelvic pain, honey, but that is not your bladder. That is not your bladder. Lower left side. I used to have bend over and screamer pain on my lower left side. And it was always associated with a bowel movement. And all I was able to do, was take Levsin to try to relax my bowel to stop it from spasming. So I was having bowel spasms, but I would want to know, Diane, what's at that location. This is a chance where a little bit of imaging matters. You could have a CAT scan. It would be interesting to see if you have a little hernia on the left side, anything else on the left side. I always say, if you've got pain in one location every single time, we have to look at that location. Is it scar tissue from an old injury? Did you have a baby? Do you have a C-section? Bikini incision that's painful? So, and the fact that you have pain on the left side of your thigh and it hurts when you walk, though your thigh muscles go right up into your pelvic cavity. And so that it's not surprising that you have pain in your thigh, and that points us a little bit more to a muscle thing. Have you had a proper pelvic floor assessment? Eddie says here on YouTube, I will definitely check that out. I had very bad IC in my 20s. I did pelvic physical therapy in the past, and it did help me. I got better in my 30s, but since COVID, have noticed to relax. But Eddie, here's the thing. You're older now. I don't know how older you are, but you also have to understand that the bladder changes with aging in a woman and the loss of estrogen. And so we want to look at the quality and health of your skin also, because that's playing a role potentially. If your vulva is dry and your vagina is dry, so is your urethra and so is your bladder. Christine said, I live in Southern California. Are there any personal recommendations? Yes. There's an abundance of physical therapists in Southern California. I think literally one of the best physical therapists in the world is Stephanie Prendergast, and she's at Pelvic Pain Rehab. They're opening a new office in Ohio. They have offices in California. They've got offices up in the Northeast. Now they're opening their first office in the Plain States. Actually in the Midwest, in Ohio. Oh, okay, Eddie. So Eddie, hold on to that. Okay, so Stephanie, who's one of the founders, practices in LA. Okay, we're at downtown LA. So if you can go to her office in downtown LA, gold, baby. I mean, I think that go to their website, pelvicpainrehab.com. Their blogs are phenomenal. They're literally the best educators in the world. I read everything they write. They've been so good. Okay, so Eddie, so you're a male. So here's the deal, Eddie. In my office, 90 to 95% of the men I work with have injury. End of story. Were you a bike rider? Were you a motorcycle rider? Were you in the military? Or did you play football? Can you remember any trauma? Or do you ride a desk? Do you sit for long periods of time at a desk? So that left side pain is really interesting in a man because that is going to point us very, very directly to muscles, nerves, ligaments, and bones. How old are you? Okay, you're 42. Okay. So, Eddie, can you remember, number one, are you an athlete? And number two, can you remember any accidents, injuries, or traumas? You ever fall on your tailbone? Were you ever in a car accident? You ever fall off a horse? Fall off a bike? Think about it and let me know, okay? And for those of you on YouTube, you're in slow mode because our YouTube gets invaded sometimes. And so you can only post every 60 seconds. I'm sorry. So Eddie, go ahead and wait the rest of the 60 seconds. You know, I'm wearing my flipper right now and it makes it a little bit harder to talk. I did get my implant surgery. And so I will have new teeth in October. Yay! That I'm missing 2 teeth back here from a dental accident. They broke 2 teeth when they cleaned my teeth last November. So, okay, hold on. Carol says, I have a bladder infection, taking antibiotics. Could the left side of the upper thigh be a nerve? Yeah, definitely. There's something called a dermatome. A dermatome is, you know, I actually printed it out. Let me see here. Let's put this to the side. Okay. So, every nerve that comes off of your spine has been mapped, and it's been mapped to whatever section of your leg or your thigh or your foot that it innervates. And so, the front of the thigh is related to L4, L5. I know this because I have ruptured discs on L4 and L5. And I have pain in my right thigh at the front of my thigh. So it's called a dermatome. And so you should look that up. And they're going to need to look at your back, see if you have any ruptured discs. Oh, I'm very casual today, so bear with me. And I've got my cell phone right there. Okay. Donna, I had my first installation today at home using the Eurodapter. Awesome. So Eurodapter is a new way to do bladder installations. It does not require a catheter. And we'll be working with the company this summer and fall, introducing this to the United States. It's really, really exciting because it's now giving us more ways to deliver medication during a flare. And let's just say you have Hunner's lesions and you're having a wicked flare. You can now do a rescue install at home using this very simple Eurodapter, and Donna just did it. Congratulations. Hold on a sec. Kayleen said, my last installation, I couldn't take a Valium since I had to drive later, and all my bladder did was spasm. Oh, girl. From now on, I'm taking a Valium for every install. My urologist did say, with whatever is wrong with the GI tract, the installations will help, and he's right. I'm going every 3 weeks now instead of once a month. Okay. So Kayleen, you're kind of at cross purposes here, and it's important that you kind of clarify this a little bit. If you're having bladder spasms, Valium would not work, because the bladder is composed of smooth muscle. Valium is a skeletal muscle relaxant. Okay, so what the Valium is going to do is relax your pelvic floor, but it's not going to stop your bladder wall from spasming. So what's important here is to try to differentiate: are you having a bladder wall spasm or a pelvic floor spasm? Your pelvic floor, listen, if putting the catheter in is painful, your pelvic floor is going to get tight. If you're driving in a car to get there, your pelvic floor is going to get tight. So what you could do is you could potentially talk to your doctor about maybe using a little bit of ditropan before your instill, because a ditropan will stop bladder spasms within 20 minutes, and you could drive home with that. Or for the skeletal muscle, to make the driving easier, instead of doing the Valium, you could do baclofen. Baclofen is also a skeletal muscle relaxant, but it's not sedating like Valium. The good news is it's working. And the good news is you're getting the treatment you so desperately need. And this is very, very exciting. Now it's about finesse. It's about finessing it. All right. So Eddie, can you remember any trauma at all to your pelvic cavity? Falling off a motorcycle, falling off of a bike, anything? You ever have a tailbone injury? Rhonda says, I was doing the instill at home. It became impossible to get both the heparin and marcaine or lidocaine. Even the urologists are having issues. Yeah, the supply chain for instills is very, very, very difficult. Very, very difficult right now. There are lots of drug shortages. Some of them are manufactured by the companies to create demand and so they can raise the price. Some of them are legitimate. Okay. Donna says, how do you think you healed your bladder wall? Because I healed my pelvic floor. My bladder wall healed because my pelvic floor healed. But most importantly, while my bladder wall was injured, I didn't provoke it. You guys, I drank a gallon of cranberry juice a day when I was diagnosed with IC. What did we do? What did we do for bladder stuff back then? We drank cranberry juice. I had a gallon of cranberry juice a day at my desk at work. And over that period of that year, I went from bad to worse. And why? Why? Well, okay, so I had a pelvic injury, my muscles were tight, my bladder wall was compromised, and I was just pouring acid on the wound every day. So I made it that much worse by drinking all that cranberry juice. Carol says, what is everyone's cure or help with the burning? It drives me crazy. Azo helps, but I hate the orange dye. Carol, it depends upon where the burning is located. Where is the burning? Tell us. Is it in your urethra? Is it in your vagina? Is it on internal or external? Donna says, if it begins with pelvic floor muscles and affects the bladder wall lining, can it cause petechial hemorrhages? Petechial hemorrhages have been thrown out in our latest guidelines as being meaningful. They mean nothing. When you stretch a bladder, even somebody with no bladder symptoms, they're going to develop petechial hemorrhages. So don't even think about petechial hemorrhages anymore. They mean nothing. They're not specific to IC. That's what happens when you stretch the bladder. Chloe says, is bladder neck inflammation part of IC? Having surgery to cut the muscle? You are going to have surgery to cut muscle? You were prescribed alpha blockers for this, but it gave you tachycardia. Chloe, clarify that. Are you going to have surgery, or have you already had surgery? Diane says, can an inflamed bladder without lesions be caused by pelvic issues? Yes. Hold on. Donna says, is massaging better than pressing on a trigger point with tight pelvic floor muscles? It's going to be a combination of both. Kayleen says she hasn't had a bowel movement since her endoscopy, colonoscopy on Monday. Girl, I hope you're eating those beans. I promise you will have a bowel movement again, but it's been 6 days. Girl, we got to get things moving. If you can feel it, If you can, we call it packing. If you can feel stool in your rectum, you just can't get it out, it's time for an enema. Works like a charm. But let's try to get your fiber intake up there a little bit. And man, if you don't have a bowel movement in the next 48 hours, I would call your doctor and let them know, whoever did the colonoscopy and what they find in the colonoscopy anyway. Eddie says, no, I've never had an injury like that. I was around 15, just started urinating more than usual. My dad always urinated a lot and was susceptible to hernias. I also feel like I have diabetes insipidus. Okay, I'm going to sneeze. Hold on. Oh, you know that feeling when you feel like you're going to need to sneeze and it's just right there in your nose. Okay, well, it's just going to stay there. You know, Eddie, we had a paper come out not long ago that talked very specifically about what's our first suspicion based upon the age of the patient. And generally for anybody who's 20 or younger, we really look first at the concept of injury. So, and it might be something you have no memory of, something that happened when you were a kid. But there isn't a guy around there who wasn't riding bikes. If you jammed your crotch on the bar of a bicycle even once badly, that could explain it. So, and the fact that pelvic floor physical therapy helped is really remarkable. It may be that the COVID, because you've been bedbound or at least homebound and not able to exercise, it may be that your muscles have slipped back into a tension pattern, you know? And so if you can't urinate right away, if you just can't relax enough to release urine, then your muscles have locked down again and you're going to need to go have a pelvic floor assessment again, you know? Rhonda says, the rescue instill truly helps me with the burning. I learned the trick toward the end of the instill to numb the urethra. Mm-hmm. So Rhonda, so when we think about what's going on in your bladder and why your bladder wall is burning, we're going to look at the concept of estrogen atrophy. We're going to look at the concept of tight pelvic floor muscles causing your bladder wall to weaken. And we're going to look maybe at the concept of, could you have an overabundance of lactobacillus minors? I mean, that research is just very, very early research, but we certainly know that, again, with our national research team, one of the things that they have been able to correlate is that patients who are flaring in pain often have fungal infection. And that the more candida found in urine, the greater the pain. And so if you notice that you flare after eating sugar or after eating carbs, then we might want to do a fungal screen to see if you have an active fungal infection. Christine says, help me to understand why IC sometimes gets better after the age of 50. Is that really true? It's true for, I mean, yes and no. I mean, I'm going to sneeze. Oh my God. Sneeze, for God's sake. No, sneeze. Oh my goodness gracious. This cold is brutal. So a couple of things. Oh, here comes another one. Like, oh my God. Okay. Oh, come on, sneeze. Let me go get some Kleenex. Hold on. Okay. Okay, and I'm getting some Vicks Vapor Rub. Okay, please, nose, calm down. I love the smell of Vicks Vapor Rub. Okay, there we go. Okay, so um, so a couple of things come to mind with that. Let's say, for example, you're a pelvic floor patient, and let's say that when you were younger and working, you were riding a desk all day, but now you're over the age of 50 and maybe you've even retired. So now we have much less stress on the pelvic floor. You're not sitting and causing issues with your pelvic floor. So that's something that could explain a change in symptoms. There are some patients, women, not men, but women who are very hormone driven. And as your estrogen levels are going up and down every month, having your periods, um, that can tweak symptoms. And once your periods drop out, your estrogen levels slowly drop. That feels better for some, but not all patients. And the other thing that's really quite interesting is how the urinary biome changes with aging. I was just reading about that this morning, as a matter of fact. In patients under the age of 45, your urinary biome is dominated by lactobacillus. You have very, very little other bacteria in your urine. They're there, but it's a lactobacillus is controlling everything. Whereas if you're over the age of 50, all of a sudden, because your pH changes, there are more bacteria that are easily present and found in the vagina. They're not pathogenic, but they're there because your pH has changed. E. coli is a natural part of the vaginal biome that usually doesn't cause symptoms until you get too much of it. Rhonda says, I will ask at my post-op appointment in a few days. I'm using estrogen cream and estrogen pills for two different reasons. Yeah, I know. Getting older is definitely not fun. Okay. Joanne says, not only do I have IC, but I have lichen sclerosis. Not sure what type of specialist. I'm miserable both days. Okay, so I'm very, very familiar with lichen sclerosis because my mother had that also. So lichen sclerosis, the name is deceptive because the word lichen kind of implies fungi or something going on there. And it's not that at all. Lichen sclerosis is severe neuroinflammation. And basically the skin turns white. You lose the pinkness of your skin and the skin turns white. And it's just massive inflammation going on in lichen sclerosis. And so generally the treatment for lichen sclerosis is clobetasol, which is a very strong steroid. It's very important. And I know for my mom, it was we had to make sure that she was using her estrogen because that skin needs estrogen to be really, really healthy. So using topical estrogen, probably a preservative-free topical estrogen, that was critical to her health with lichen sclerosis. And honestly, she felt much better taking warm baths with Aveeno, Aveeno. They are oatmeal, colloidal oatmeal that you put in the water. When I was having vulvodynia, I used baking soda. But it's about calming nerves down, calming inflammation down, making sure we've got good blood supply, making sure we've got nice, healthy muscles. She did not have healthy muscles. And even, Joanne, like the single most important thing you could do is use this. Let me see if I can find it. Here we go. A Perry bottle. You can get these in the IC Network shop for $3, $3 or $4. So because your skin is so incredibly tender to touch, anything that touches it is going to hurt. Urine is going to hurt. And the problem is we urinate several times a day. Toilet paper does not get the chemicals from urine off of your skin. Water does. And so having this next to your toilet, fill it up with cool water and rinse yourself off every single time you pee to get any residue off of your skin is important. Also, Liz, you gotta really clean up chemical exposures to your vulva. Be very careful. You should not be douching. You should not be wearing underwear that's been treated with a fabric softener. If there's a scent to it, those chemicals from the scent are going to irritate your vulva. She has a whole list in here of her vulvodynia. Hold on, let me get it. I had vulvar pain within 5 minutes of wearing underwear washed and tied. Oh, let me see if I can find this because she had the master list right here. Yeah, my mom was tough. Let me tell you. You wouldn't know it talking to her. She was a sweet, kind, calm, loving person. You never know. You would never know that she suffered so badly with vulvodynia. Okay, this is from her. Interventions that attempted to alleviate vulvar irritation, inflammation. Cotton underwear, white. She also didn't wear underwear a lot. She wore house coats. But even 30 years ago, we all got into the habit of that. I was doing that in my 20s with my vulvodynia. Baking soda baths, mild laundry detergent, swabbing the affected area with peanut oil or coconut oil to give you a little bit of a protective barrier there. KY ointment. She found that using white Kleenex rather than toilet tissue was very helpful for her because toilet tissue leaves a lot of cotton dust. Like the toilet tissue I've been using recently, when you pull it off the roll, oh my God, the dust is coming off. That's ridiculous. I'm going to go back to my bamboo toilet tissue. So she found using Kleenex, white Kleenex, is very important. Of course, the problem with Kleenex is that it's much harder to go through your septic or through your sewer. So you end up throwing it, you just got to be careful. Don't put 5 or 6 pieces of Kleenex in your toilet and expect it to go through. Many times she clogged our toilet. She did vitamin E every day. She worked with her estrogen levels. This is starred, a perineal wash bottle after urination. Be very careful. Don't use baby wipes. Don't use Cottonelle. Don't use anything like that. The only wipes you can use, let me go get them. Hold on. Where is it? Oh, I sent them to water wipe. They're called water wipes. Water wipes, and they're at the grocery store. Like 99.99% water. But be really careful of things like Cottonelle. They're kind of notorious for irritating some people. Okay, so I hope that helps. Eddie says here, I think you're right. I've had long COVID for 3 years and can no longer exercise, so I'm frequently in bed. I take Elmeron, and when my bladder keeps filling up, I use desmopressin nasal. Yeah, honey, I'm so sorry. Listen, you got to get yourself up out of bed. Even if it's 5 minutes at a time, the more you move, the better you'll be. The more you lay in bed, the weaker everything becomes. What the hell is that noise? Oh, it's my neighbor. Okay. take it from somebody who's spent a lot of time in bed over the years. I've never been healthier than I am now because I am walking constantly. I'm up and moving. I found that the more I laid down, the worse I felt, the worse my muscles got. It's hard. You're in a difficult situation and you're not going to be able to go walk a mile right now. If you can just get up once an hour and walk up and down your hallway for 5 minutes and work with your doctors and believe in physical therapy and just believe, the human body is amazing. The human body healing is always happening. Your body is trying to heal right now, but we've got to give our body everything we need to heal. And a good part of that is getting vertical. If you need a pep talk, Eddie, you know who to call, honey. I'd love to talk to you, and I would love to work with you. Now, I have another thing that I'm a little bit concerned about for you, hon, is the Elmeron. I don't know if you watched my meeting 2 weeks ago, but Elmeron used to be the favored drug, but we had new research from the Emory Eye Center, which found that Elmeron actually damaged retinas in some patients. Patients developed a new retinal disease called pigmentary maculopathy that can be quite severe. So when that research came out, Elmeron use started to scale way back. Now we have a new, much more devastating symptom associated with Elmeron use, inflammatory bowel disease. That's another big story that dropped in late May. And so it was the researchers at the Emory Eye Institute who were doing their ICI studies who found that many of those IC patients also had really significant inflammatory bowel disease, and some had to have colectomies. Their bowels were removed. And they have been working on this research for a couple of years. They just published their first paper in May. Although, if you go back in time, I want to be careful what I say, because if this ends up in litigation, they're going to look at what I say. So I want to be really, really clear here. We have known from day one of FDA approval that bowel symptoms were possible. This is no secret. And there have always been a small group of patients who develop diarrhea, rectal bleeding, and in many cases they blamed the capsule, and that's what they told us to tell patients, or back in those early days in the late 1990s, early 2000s. Okay, if a patient's having bowel issues, tell them to take it out of the capsule, that they thought the capsule was associated with issues related to the bowel. Well, the research from Emory and the research that they're now doing, it kind of slam dunks that theory. And I think too, when you think about an adverse event, when you think about a side effect, so here's a medication that's supposed to help your bladder, that appears to help your bladder, but it has a long history of bowel issues for some patients. And so it's like, okay, if you have the bowel issue, just don't take it. But what happens if you're so desperate, you keep taking it anyway? And more importantly, what is it actually physically doing to your bowel? Is it changing your bowel? Is it damaging your bowel? And so there were, I think, 5 various case studies published in the literature. I think the first one, it was in 2005 or 2006. It was a case study of 2 patients who developed either inflammatory bowel disease or dysplasia. Dysplasia means the surface of the cells are now grossly changed. And when you see that, that's associated with a greater risk of cancer. So we have a number of little case studies that have been published over the years, but now we're getting much more concerted look at what is it doing and what are the risks to the bowel with long-term Elmeron use. This was right when my parents died, and I had the article written. I haven't put it on our website yet. I haven't put it in our, I mean, literally my parents died that week. So I'm going to have that on our website. I just wanted to get a full set of references in there. That's the last thing. And hold on. So if you're having any bowel symptoms or you're having any eye symptoms, what the Emory researchers and that's the other thing about the case studies that have been published with IC patients using Elmeron is that when they stop using the Elmeron, the bowel symptoms generally go away. So even though we don't have the research that proves that Elmeron causes this, when you look at it from the other way, it's like, okay, but when you stop the medication, the symptoms go away, and that's documented many times. You can make that correlation a little bit more successfully. Here it is right here. Yeah, here it is right here. Here's the whole article. So, yeah. 2005, first case study from Texas A&M. A 29-year-old woman developed bloody diarrhea and cramping abdominal pain 1 month after starting Elmeron or pentosan polysulfate. They looked at her rectum and lower intestine, found ulcers and red bleeding tissue. They found colitis from her rectum all the way up to her transverse colon. Her symptoms completely resolved when she discontinued using pentosan. The other case study now is a 59-year-old female with IBS. History of IBS, developed increased diarrhea and lower left quadrant abdominal pain 2 weeks after starting pentosan. Colonoscopy also revealed ulcerations and changes consistent with colitis. Colitis treatments did not work. However, her abdominal pain and diarrhea improved after stopping pentosan. In 2015, researchers at the University of Missouri and the UC Irvine published a case study of a 32-year-old female with IC who had struggled with diarrhea for 7 months. She had abnormal cramping, loose bloody stools, 20 bowel movements per day. Typical bowel treatments didn't work. However, when Elmeron was discontinued, her symptoms resolved over a couple of weeks. Can you imagine having diarrhea for years? Going to the bathroom 20 times a day? If she was living in her bathroom. In 2022, researchers at the Oregon Health and Science University found 30 patients, 10 of whom had colonic dysplasia, which is bad. The presence of mucosal inflammation is a known risk for the development of colorectal cancer. Dysplasia is a precursor for IBD-related colorectal neoplasia. Thus, early identification is critical. And so the question is, okay, well, how could it possibly be damaging the bowel? And this is where it gets very interesting, because in IC research, in quote unquote IC research, going back years, they used to deliberately damage the bladder with a medication called dextran. And dextran is dextran sodium sulfate would induce intestinal inflammation. And it turns out that pentosan polysulfate is also a sulfated polysaccharide with a similar structure, suggesting that this could be a drug toxicity, although this must be confirmed in additional research. And now we've got the new research. And we have information showing that some patients have had to have a colectomy. It means a portion of their colon removed. So, Eddie, I would. So, what can you do instead of Pentostin for your bladder wall? I would be looking at the supplements, Bladder Builder or Bladder Rest or Cystomend in particular, because it's a very robust chondroitin supplement that helps to coat the bladder. Bladder Builder makes a little bit more sense also because it has PEA in it for pain relief. So most of the patients who have gone off of the Elmeron have switched over to one of the supplements. Eddie says, I only use it as needed. I did hear about the ocular symptoms, but got checked in an eye doctor. I do have IBS symptoms though. So yeah, Elmeron's not meant for as needed use, hon. You're not understanding the mechanism of action. Elmeron is a coating. It it's a very, very small molecule. In fact, I have a. This is one of the early Elmeron. See, it says Elmeron right here, right? So this is one of the early educational tools. And so the theory here, oh, see, it's so hard. Okay. The theory here is that your bladder lining has been damaged and it is now allowing urine to penetrate. And so you can see here that they have the Elmeron coating that wound area and creating a barrier. But, you know, you have to focus on why is it wounded in the first place. You could chase your symptoms for years and never get better with a lot of stuff. We have to get back to the fundamental. You know, you are an anatomical mystery to be solved. What the hell is going on in your pelvis that's making your bladder so vulnerable? And so, do you have ischemia from tight pelvic floor muscles? That would be the number one thing that we would look for in a guy. And as you said earlier, pelvic floor physical therapy helped you. So, you know, you're doing what I call chasing your symptoms. So rather than chase it with a medication that could damage your bowel and damage your eyes, most former Elmeron users have transitioned over to I would say these would be your top contenders. Cystomend is the strongest coating chondroitin on the market. And again, it's not none of it doesn't work on an as needed basis because it takes time to build up. So I don't understand how you're using it that way. It doesn't really make sense pharmacologically, right? So Cystomend, and I'm a pharmacologist, hon. That's my original training, bladder builder. So those are viable options. Somebody asked Dr. Parsons, hold on. At the 2006 IC conference in San Diego, somebody asked, will I have to be on Elmeron for the rest of my life? And the answer is no. We just have to figure out, is it helping you or not? So if you were taking 3 a day, what he said is go down to 2 a day. See if your symptoms change. If they get worse, it might be helping. If they don't change, go down to 1 a day. If your symptoms don't change, stop, see how you do. And then the second question was, well, how do you transition from Elmeron to a supplement? Because Dr. Theoharides, who is the doctor who invented Cysto Protect, was on the stage with him, and it was a one-to-one transition. So if you're taking 3 Elmeron a day, what they said is, okay, do 2 Elmeron and 1 Cysto Protect. Do that for a week. See if your symptoms change. If they don't, go to 1 Elmeron, 2 Cysto Protect. See if they change. If they don't, lose the Elmeron, do the supplement. Now, Cysto Protect is an older formula. It's not as popular now as Cystomend, but that one-to-one swap makes sense. It makes sense. Eddie, like I said, I will have that paper on our website, hopefully this week. Okay. Kayleen says, I think the spasms are anxiety. He noticed when I do take Valium because the solution pours right in. Okay. That makes sense. Bonnie says, have you ever heard of those going into a flare from a dairy allergy? Yeah, allergies can, if you have a history of allergies, it's well known that icy symptoms can flare during periods of intense allergies, especially, for example, the Santa Ana winds in Southern California. That was something Dr. Parsons noticed very quickly. And so for patients with a history of allergies, that's where they suggest using an antihistamine like hydroxyzine, that helps to stabilize the whole allergenic thing going on. Donna says, in addition to not provoking your bladder with the elimination diet, what else should you do to heal your bladder wall? Well, the antidepressants didn't work. The DMSO did not work. The other thing that I did that just calmed my entire body down was getting control of my anxiety and learning really good anxiety management skills, which has calmed my entire nervous system down. From the brain down, I just calmed everything down. I was just living in a constant state of very intense anxiety. And remember, too, that pain that is accompanied by anxiety will be intensified by the brain. Pain that is accompanied by laughter will be minimized by the brain. And so it's important that we not live in that anxiety. That if you live in that anxiety, you're going to get stuck there and it's going to intensify all of your symptoms. Donna says, can you explain some of the best supplements and what they do to heal the bladder wall? Well, no supplement heals the bladder wall. Only the bladder heals the bladder wall. But supplements can help create an environment that will help the bladder wall in that healing process, kind of protect the bladder wall. So when we think about a coating, for example, going back to this, the point of having a coating is that it will prevent urine from being so irritating. It keeps the urine away from the more fragile cells down here, right? So if, for example, you are an estrogen atrophy patient, your symptoms are being driven by low estrogen levels, and yeah, you're using topical estrogen, but you're never going to have a 20-year-old bladder again. You're not. And so doing something that has a bit of a coating effect, it makes total sense. And that's where Elmeron really shined, was for women with estrogen atrophy. And so what else provides a coating effect is chondroitin. And in fact, in Europe, chondroitin is a treatment for IC. A liquid chondroitin instilled into the bladder is called Uracyst, or it's part of an ingredient in an installation called Ialuril. So chondroitin is a natural building block of the bladder wall, and it's essential to the superficial integrity of the bladder wall. So for those patients where we're trying to protect their bladder wall, we're going to be looking at a chondroitin-based supplement. So that's going to be, let's see. Did I drop it? Let's see here. Let me take this one down. Yeah, okay. And the good news here is, unlike 20 years ago, now we've got some really good companies who are producing much more kind of intelligent supplements than the throw the bathtub at the bladder of 25 years ago. So the starter formula that is recommended, or not recommended, suggested, is called Bladder Rest. And this is really for people who are very sensitive, and we always say, don't take a full dose the first day, for God's sake. Any of the supplements can cause stomach upset too. So this is about taking one, see how you feel, one a day for a couple of days, see how you feel, go up to 2, 3, 4. So all of the chondroitin-based supplements have chondroitin and quercetin. So the chondroitin has a bit of a coating effect, while the quercetin has a bit of an antihistaminic effect. So whether it's the Cystomend or the Cystoprotect or the other Cysto, I forget the name, it's Cysto Renew, the chondroitin quercetin is kind of the foundational ingredients from research we had 20 years ago. So again, good bladder, this is a good starter, especially for people like me who are redheads who tend to be sensitive and scared to do stuff. Bladder Builder is, in my opinion, the best supplement on the market. And the reason why I say that is because it has the most methods of action. So yes, it has a chondroitin for the bladder wall. It's got the quercetin for the antihistaminic effect, but it's also got some beneficial probiotics for the gut. And it has PEA, palmitoyl ethanolamide, for to calm nerves down. And we had a research study in 2019 that showed that a combination of PEA and resveratrol was stunningly successful in reducing pain in IC patients. That was a research study that was brought by researchers from Europe. And 87% of IC patients who tried PEA reported a significant reduction in their pain and discomfort by month 3. So this combines the coating effect with the nerve calming effect. And so that's why I continue to believe that this is the best supplement on the market today. But, it's a strong, very robust supplement, and it's too strong for some patients. And so it's a go slow and try it and see how you feel. Also, I've never been a full dose person because I'm a redhead anyway. I will tell you that when I tried Cystoprotect 20 years ago, I could take one a day and I was fine. And it was interesting because it felt like warm cotton candy in my bladder and I kind of liked it. But when I went to 2 a day, it gave me diarrhea. And when I went to 3 a day, it was impossible. And so for me, 1 a day was good. And it worked well for the brief period of time that I did it. And that tends to be the way my body is anyway, with whatever I take, whether it be a supplement, a vitamin or my thyroid medication or whatever. My body prefers low doses over time. I don't tolerate high doses well at all. So it's about finding the dose that works for you. So if taking one of these a day works for you, well, this is a deal because this is a 4-month supply for under $50. So that'd be fantastic for saving money. And then Cystomend is the newest supplement. There's no PEA in this, but this has the most chondroitin of any of the supplements out there, and this is very, very popular for people who have for that postmenopausal woman using Elmeron or who were using Elmeron. This seems to have the best layering effect or coating effect. That's our guess, but that seems to be working well. Now, something else that people come up with is aloe. I mean, aloe has been around for a long time. And we sold aloe for many, many years in the IC Network website. I would never say that aloe is bad, but what I would say is let's look at method of action. So aloe is soothing to a sunburn on your skin. So aloe can be very soothing to your bladder also if you can tolerate. Not every patient can tolerate aloe. It can cause some gut-related effects. But it's not what I call constructive to the bladder. The bladder is not made of plant material. So I don't see it as, I see it, its strength is in flare management. Its strength is in calming and soothing an irritated bladder. But over time, I personally believe that supplements that contain chondroitin are going to have a more constructive effect. So the aloe that we now carry is called Aloe Path. And the reason why we carry this is because it enhances the soothing effect of aloe with PEA, palmitoyl-ethanolamide, for pain relief or for calming nerves down. So we have quite a few patients who are using this for flares now. Very affordable. It's in the IC Network shop, made by the same company that makes everything else. Now, a lot of people ask me, Jill, what do you take? I want to take what you take. And my answer is always, that's bad, because you need to take the supplement or the therapy based upon your unique case of IC. But this is what we know about me. I have a healthy bladder wall. Hello, I'm drinking lemonade today. My bladder wall is healthy. I do not need a coating effect. I do not need chondroitin. But what I do have is extremely sensitive nerves. And so I just take PEA every day. And it's just about keeping the nerves in my skin very calm and collected. And so I'm thrilled with PEA. The data behind PEA for fibromyalgia, for surgical pain, acute pain, chronic pain, bad hips, arthritis, it's considered, and the great majority of IC research studies find no side effects. Studies find no side effects. It's an endocannabinoid. The general consensus among the researchers is it's really good for calming nerves. Yeah. And so for those of you in IC subtype 5 central sensitization, this would be really interesting to consider. And these are all over in the IC Network shop, icnetwork.org. I should say something here. I wear many hats, right? So I'm a support group leader, but I also own a business. I own the IC Network, right? But being a support group leader supersedes me owning the IC Network. I want to be your support group leader. I don't want you to think that I'm using this to push anything. You are a unique case of IC. You are a unique case of pelvic pain. I'm just trying to help you understand your options, because in the IC world, the only oral medication approved for IC is now linked to blindness and inflammatory bowel disease. There's nothing else. And so I see supplements and so does the American Urology Association in their own guidelines. They encourage you to try the supplements. They don't recommend them by name, but they encourage you to try nutraceuticals, because nutraceuticals have a long history of success in the IC movement. And it's something you can try if there's nothing else out there. And right now, there's nothing else out there other than antidepressants and antihistamines and cyclosporin. So, and better yet, it doesn't require a prescription. And so for patients who don't have access to medical care, they can't afford traditional meds, they don't have a doctor who believes in IC, I think it's a blessing that we have some supplements that might be worth trying. But I encourage you to talk to your doctor about it, do your research. You can come on over to our website, look at your options there. The most well-known supplement of all is Pre-Leaf. And Pre-Leaf, here you go, is a sponsor of this live support group meeting, and they have been for 20 years. Pre-Leaf does not act on the bladder. It just reduces acid in the foods you're eating so that they don't irritate your bladder so much. It's a simple calcium pill, calcium glycerophosphate. You take 2 Pre-Leafs, that'll remove 95% of the acid in a cup of tomato sauce, right? And so Pre-Leaf is also a very, very viable option, but it's not a treatment for IC, and you don't eat it like candy. This is when you're eating a food that has a potential of risking. This has been out for 30 plus years. The guy who invented it, Alan Kligerman, was a friend of mine. And I will actually tell you that years ago, he was going to discontinue Preleaf. And I begged him not to. And I ended up doing a 1-year marketing campaign for them that saved this brand. So I'm very proud of Preleaf. It's a viable option. It's helping some patients have a more balanced diet. So we have an abundance of options. And it's not just me saying it, it's our own American Urology Association since 2011 actually encourages patients to try over-the-counter nutraceuticals before you try prescription medications that come with side effects. Okay, so there you go. Chloe says, doctor said my bladder looked good, just the bladder neck was inflamed, which is making me not completely empty, more susceptible to infection. Since I had a terrible reaction to alpha blockers, I have to have surgery to make an incision at the bladder neck to get me to empty all the way. My question is, bladder neck inflammation part of IC? Well, IC doesn't mean anything. Interstitial cystitis doesn't mean anything. It's based upon an old, since proven theory that the interstitial layer of the bladder wall was sick, and now we know that that's not true. You have what we call bladder-centric pelvic pain or urologic chronic pelvic pain. That's the correct diagnosis. Is bladder neck inflammation part of primary bladder syndrome or whatever they're calling it now? The answer is yeah, it could be. So we want to try to figure out why your bladder neck's so inflamed. Generally, what we look for is chemical irritation. The bladder, like any other part of the body, can be injured, and generally it's injured through some sort of toxic chemical exposure. So if you've gone through chemotherapy, that would do it. But if you're drinking soda or coffee, or if you're taking medication that is irritating your bladder wall, or even if you're drinking alkaline water all day, that's actually quite bad. That's going to damage the bladder wall. So it sounds like there's something on a daily basis that you think might be okay that is actually caught a long-term source of inflammation. A multivitamin. Are you taking vitamin C every day? I would want to look at everything you're taking every single day, and let's just make sure you're not accidentally shooting yourself in the bladder and causing a lot of that inflammation. You'd be amazed. Every week this happens. You know, I've been doing this for 30 years. This comes up all the time. And sometimes it takes to talking to somebody like me to ask, you know, really in-depth questions, things that you thought were okay, like a multivitamin, you know, or an eye formula. If you're taking an eye vitamin for, what do you take it for? Glaucoma? Those are really high in vitamin C. That could irritate your bladder wall. So it'd be very interesting to try to figure out what your subtype is. Carol Ann says, thank you so much. So the doctor, you will tell the doctor, give you an MRI on my left side for a hernia. I did think my colon as well. If he does a spine test, will that show on MRI? I don't know. I don't know, honey. Eddie says, will decaf coffee cause bladder inflammation? Hell yes, it will cause bladder inflammation. Absolutely. Just because it's decaffeinated doesn't mean that it's not acidic. And listen, with long COVID affecting your bladder, you got no business drinking any coffee at all. The only coffee you should be drinking is Dandy Blend. This is an herbal coffee that has absolutely no acid or caffeine in it. You could drink this. You can go to town with this every day, and it would protect your bladder. But a decaf coffee, that's a big mistake for you, honey. Elke says, article by Jeffrey Kluger in Time Health on PFAs and tampons. You've been using tampons since 1974. You often used it on no-day periods to stay fresh at work. What? Oh, girl. Elke, yikes. Yikes. So basically what you did two things. You didn't understand. See, the thing that's so amazing about the vagina is it's like literally the cleanest part of the human body. And the reason why is because it sloughs off its cells every 4 to 5 hours. So that natural discharge is actually dead cells that your body's getting rid of. Yeah, the tampons that you were using were also pulling away the healthy mucus that protects the skin. That skin is meant to be wet. That there's a barrier. That wetness. This works for mucus too. That mucus protects the tissue from anything that could encounter it. So now we've got super dry skin, and you've got a tampon that has PFAs in it, and the PFAs can just pass right through. They can right through these areas where it's super dry. And I'm so sorry you had endometrial cancer. So did I 7 years ago. But we caught mine very, 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 very early. So I had to have a hysterectomy. So now I asked my doctor why. We have no history of estrogen-driven cancers in my family, none. I don't have any relatives with breast cancer, uterine cancer, cervical cancer, nothing. My mom took estrogen for decades. And I thought, you know what? I was having a lot of muscle cramps. I was having, foggy breathing with menopause, or foggy thinking with menopause. Like, I want to try it. And I took it for 3 years before I started spotting, which was the first sign that bad things were happening. And I asked the doctor afterwards, after this 1 year trauma of going through all these procedures and all these surgeries and everything, I said, why me? Why me? For God's sake. I mean, nobody in my family has any history of this. Why me? And he said, Jill, you just have a cell that gets turned on by estrogen. That's all. So I'm sorry you went through that, Elkie, because I did too. And I will tell you, I rarely use tampons. When I did, I used OBs. The whole little tiny OB tampon. But see, remember, my muscles were jacked up, and so tampons hurt. Tampons never felt good for me because putting them in tweaked my very tight, injured pelvic floor muscles. Elke said, did you use radiation? Mine stage 1, grade 1. You thought brachytherapy would kill the bladder, so you passed on the 15% chance. Honey, they didn't need to treat it. They caught everything. My actual diagnosis was complex endometrial hyperplasia with atypia. So the atypia are the cells that become cancer cells with, quote, a vague architectural complex. That's straight from the Stanford pathology labs. So what that meant is that it was just at the earliest moments of starting to build cancer. So it had laid the foundation, but it hadn't built it, right? The tumor didn't get built. The adventures of life. Let's see here. David says, Chloe said, had a UTI 4 months ago, one last year on the IC diet plus four plus months. So Chloe, just remember that if you're struggling with recurring UTIs, what the research shows is that's usually related to estrogen atrophy. And so if you have 2 UTIs in 6 months, 3 UTIs in a year, you are in the recurring UTI category. And generally, in addition to treating you with antibiotics, they usually provide a topical estrogen to use vaginally to improve your skin health so that the bacteria cannot find a home. David says, is Cystoman the best supplement for Hunner's lesions? I don't know, hun. You know, Hunner's lesions are their own separate beast. I would think that Cystomen could provide a nice coating effect for Hunner's lesions, but I would also probably add some Piora to calm nerves down. But I just don't have any research into it. There's never been a research study with Hunner's lesions and a supplement. Remember, too, some Hunner's lesions are connected to viral infections, polyoma infections. And so, Eddie, this makes sense for you too. Um, it might be interesting to consider using a lysine supplement. We don't have any in the IC Network shop. Lysine interferes with viral replication. So I know when I was hit with COVID a month ago, I did a lot of lysine. Lysine is an amino acid which interferes with viral replication. So we use it. Oh God, the other thing that happened. Oh my God, what is in addition to having wicked COVID is I got this monster cold sore. I was like an inch big. And, you know, when they say with periods of high stress, herpes comes out. Well, believe me, I had a massive cold sore. And so I was also doing the lysine for that. And it only lasted like 4 days. Sharon says, I gave up caffeine many years ago because it makes my heart worse. I said, me too. I won't touch caffeine. I've been cutting out methenamine hippuric because doctor has me taking vitamin C with it. It's to keep the UTI away. I was botched with a mesh, cut my urethra in half. Oh, honey, I'm so sorry. I never used tampons at all. I went through menopause early after fibroid tumors and endosurgery, put me on birth control for 6 months to stop periods. And that was the end until many years later, having the hysterectomy, finding adenosis was growing inside my wound. Hindsight is 2020. I know, right? Chloe said, what supplements are good for inflammation and frequency? Well, remember, the inflammation is going to be occurring either because nerves are super irritated from tight muscles, or there's something, bacterial infection, viral infection, something like that, or just, you know, if urine keeps getting where it's not supposed to be, here, hold on. If urine keeps getting down here and down to the nerves, that's going to cause neuroinflammation, right? So doing something that might protect the tissue to keep the urine off of the wound makes a little bit more sense. So again, doing a chondroitin-based supplement. And also know that the symptom of frequency urgency, that's actually most commonly associated with tight pelvic floor muscles. So you want to make sure you get your pelvic floor checked. Elke said, did I refuse radiation? No, I didn't. They didn't offer it to me because we caught it before the tumor actually grew. I mean, it was just the foundation. So they felt, they felt that I did not need to have chemotherapy or radiation because we caught it in the nick of time. Obviously, they chopped up my uterus and looked at it, and yeah. Hey guys, let's take a bathroom break, okay? I will be right back. I just need to go to the bathroom. All righty then. I'm going to sneeze. It's coming. Well, we've been going for almost 3 hours, so that's pretty good. No, 2 hours. No, 2 hours. That's pretty good considering I have a pretty wicked cold. Any other questions out there? Hit me. Go ahead and hit me. If you got a tough question, go ahead and give it to me. If you don't and we're done, that's fine too. I'm going to make some stuffed bears for the great grandkids using my mother's flannel house coats. And maybe go sit in the sunshine and soak up some vitamin A. So any questions out there? Any questions? Go ahead. Give it to me. If you got it, hit me now. Oh, Eddie said you haven't tried the amino acids? Dude, come on. Lysine is a no-brainer. I mean, if you've ever had cold sores or herpes, canker sores, there's a product called super lysine, and they make a chapstick. And they make drops that you can put into water and swish in your mouth and stuff like that. That stuff is the bomb. I got my I don't know. I don't even know how I would describe him now, but I dated a guy who served active duty in the Middle East. And when he came home and we made love, the roof of my mouth was covered in canker sores. I mean, like 100 of them. It's like, what? And it was something that he got, and it only happened once. Praise God, hallelujah. So when I flew home here to California and they saw the roof of my mouth, they sent me to an infectious disease specialist, and it was a virus. And so they started me on lysine. And if I ever get anything like that, man, I just either I have chewable lysine or I've got lysine drops that I swirl in my mouth. And so, but this lysine chapstick is fantastic. So normally a cold sore would last a week to 10 days, but with this lysine chapstick, it's like 3 days. So adding some lysine to your daily routine, no brainer. It's an amino acid. And there was actually an early study by the guy who made the discovery about lysine interfering with herpes. When COVID hit, they were doing a lysine COVID study too. And honestly, I just haven't dug into the research to look at what they found. But it just makes no sense. I mean, it makes sense. Doing something that interferes with viral replication is the right thing to do if you've got a viral infection. Sue, you're still doing good on the icy diet. Sleepy time tea does seem to irritate. Yeah, because it has rose hips in it. Look at the ingredients. Sleepy time is absolutely something you should not do. Rose hips are acidic. No low acid coffee yet. Shy, but there's no reason to be shy with the Dandy Blend. The Dandy Blend rocks. It's so good. No. So I wouldn't we'd be scared of Dandy Blend at all. You can make frappuccinos with it and you should be fine. Nobody's ever flared from it that I'm aware of. It's got rosebuds in it. Yeah, sleepy time is notorious for being irritating in the typical IC patient. I don't remember the other ingredients in it off the top of my head. Let's look it up. Sleepy time herbal tea ingredient. The other thing about herbal teas is I would want to have organic teas whenever possible. So it's got chamomile, spearmint, lemongrass, which is fine. It's got tilia flowers. I don't know about the tilia flowers. The blackberry leaves fine, but it's got the hawthorn and the rosebud. So it's never been. I mean, it's been around since I was diagnosed, and it's never been IC friendly that I'm aware of. Just plain chamomile or a combination of chamomile and peppermint. Or on our website, we have a fabulous rooibos tea. Oh. So we have two other teas that you might find interesting. This is a pumpkin spice rooibos, but it's not pumpkin-y at all. It's more like caramel. This is a great dessert tea and very, very IC friendly. And then another tea that we have it's called Chill. It's by Harney and Sons, who makes this. And this is chamomile mint with a little bit of CBD from hemp. And so Chill might not be a bad thing to try either. Let's see, when does this one? This is my demo. It expired last year. Otherwise, I would send you this. Let me open it up. Since it's expired, let me open it up. Let's see if I can break through the middle tape. Do I have some scissors here? Let me tell you, my house has never been as clean as it is right now. My office is so clean, my house, because we had the reception here Friday afternoon. Okay, let's see what it smells like. It just smells like chamomile. Chamomile with a little tiny bit of mint. It smells good. Yeah, it smells really good. Dang, I should try that. I'm just I don't really like chamomile that much. What's the brand name again? This is Chill, Chill, and this is pumpkin spice, and the brand name is Harney Teas, Harney, Harney Teas, and these are over on the IC Network website in our tea area. So for those of you who just came in, we're doing a support group meeting for patients who have pelvic pain, bladder pain, long COVID, ketamine, cystitis, et cetera, et cetera. Sharon says, what are my thoughts on D-mannose? It's neuro-anti-inflammatory as well as antibacterial of the bladder. A girlfriend swears by D-mannose and alpha-lipoic acid. D-mannose seems to take down swelling in my ankles too. Cardiologist said it couldn't hurt. It's not going to hurt. Here's the problem, honey. The human body does not use mannose. There's no biological role for mannose in the human body, like glucose or sucrose or fructose. Mannose is not used. It is immediately excreted in your urine. And so any mannose you take, you pee out quickly. So it is not doing what you think it's doing. What makes D-mannose compelling for patients with UTI, E. coli-based UTI, is that it has a receptor on it that matches a receptor on E. coli. And so if you have E. coli swimming in your urine and you have D-mannose in your urine, they attach. And when they attach, the E. coli can no longer affect your bladder. And so they attach into a pretzel and then you pee it out. So mannose, when I did my reading on mannose years ago, it was not associated with any beneficial effect in the human body. Now, just out of curiosity here, they say D-mannose might help a deficiency caused by a genetic defect. Well, what the hell is that? It is used for an inherited disorder called carbohydrate deficient glycoprotein syndrome type 1B. Oh, it looks like there's a lot more research. I mean, I last read about this over 20 years ago. It's been a long time. So I could be very much out of date. I'm going to have to put this on my to-do list. So hold on. And I'm going to sneeze again. Oh my God. Oh, clearly I am extremely out of date. I apologize for this. So hold on a sec. Let's just go to the National Library of Medicine. Because I haven't read about this condition. D-mannose methods of action. Cystitis, mannose binding lectin on bacterial infected chickens. A study comparing mannose with N-acetylcysteine. Oh, I don't know. I'm not seeing anything quickly here at the National Library of Medicine. Let me see if I can publish by most, what? No, most recent. I don't know, hun. I'm going to have to do some reading on this. I mean, let me just say this. I don't know of a single doctor who would suggest D-mannose for quote unquote the bladder wall issues unless you have a proven E. coli infection. All right. Any more questions? Thank you for giving me more work to do. Always happy to do work and to research stuff now that, especially now that I can. I have a little bit more time now. I'm here for you. If you're done, I'm done. If you got any questions, go ahead and ask. Go ahead and ask them. I can, oh, okay. So, I will tell you that for those of you hanging around and you're just listening and you kind of want an update from me, my parents' service was Friday, and it went really well. Um, the minister didn't show up. Like everybody's sitting down, I walk up to the minister. I walk up to the mortuary person, and you're like, "Where's the minister?" He goes, "I don't know. Did you talk to the minister?" And I went, "No." "Didn't you talk to the minister?" And he went, "No. I thought you were doing it." And I'm like, so the minister didn't show up because neither one of us talked to the minister. So anyway, I did their graveside service for the group, and it was really good. It went well. Helped indeed by a teaspoon of codeine-driven cough syrup for my cough. um, but two things happened. So the second thing that happened is one of the guests came with a card that she'd sent to me, condolence card, and said, you need to know about this. And I'm like, what? She goes, gave me the card. The post office was returning my email reporting that I was dead. You can't make this up. You can't make this up. I had to leave the reception to go to the post office with my driver's license to prove to them that I was indeed alive. Oh, and then something else happened too. I don't even remember what that was. So um, we are just much more. It's a little better now. I'm not crying as much. Grief is new. So we've never had a death in my immediate family. Sharon says, okay, take my alpha lipoic acid daily. It helps with my neuropathy. I have a question. The D-mannose for neuroinflammatory. I would instead be looking at PEA, because the research beyond PEA calming nerve-driven pain down is exceptional. This makes a lot more sense in D-mannose. I mean, there are dozens and dozens of research studies showing that PEA is very successful at reducing nerve-driven pain. So this makes a lot more sense, Sharon, in my opinion. All right. Well, I think you guys are done, and I'm super congested, even though I sound kind of okay. I think this is a good place to stop. We had a good meeting today. I will be back on hopefully Thursday or Friday, and certainly next Sunday. And I want to thank everybody who sent letters of and notes of condolence. It's been a brutal month, but the worst is past, and they're with us. They're with me. I have no doubt. I feel, in fact, last night while I was sleeping, I heard my dad yell my name. He had a very distinct way of saying my name, especially if he was angry. You know, I accidentally, this is so funny. Um, oh, and I have a funny joke too. So, the last week, my dad needed a walker at home. He was always very independent, very strong. Legs were very strong. And he finally got to the point where he just needed a bit of a walker. But so my mom needed her walker too. And so my mom was in a rush to go to the bathroom, so I had to move my dad's walker across the room, about 6 steps away, to get my mom, because she's having an accident, hustle with her to the bathroom, do all that thing. And so I'm working with my mom in the bathroom when I hear my dad. Let me tell you, at 100 years old, he could still yell at me like I was a kid. He let out that Jill, wail slash, and I knew immediately as soon as I heard it. I was like, "Oh my God!" I moved the walker, and by this time I'm in the middle of dealing with stuff for my mom. So I sit her down, run out, give him his walker. I'm so sorry, Dad. Run back, gave her for my mom. Oh, that was it. And my dad was also very, very funny. And so um, the day before he died, he was still there. And So my brother and I drove down and we sat with him that afternoon. We had a really, really good conversation, and Dad was, he knew what was happening. He was all there. He was his normal, vibrant self. I mean, obviously he had oxygen. He was laying in bed and he was weak, but he was mentally all there. So when I was out in the hallway, the chaplain came up to me and said, "Would you like me to see your dad?" And I'm like, I'm looking at him. My dad not particularly religious, but my dad had strong faith, but he wasn't a Bible thumper. He didn't go to church, but he loved a good religious debate. So I'm kind of looking at him, thinking of my dad, going, "Ah, sure, come on in, right?" And so the chaplain comes in, very soft-spoken man. And so I'm sitting on one side of my dad, my brother's sitting on the other side of my dad, and the chaplain's at the corner, and I mean at the foot, and I tell them, I say, "Dad, well, this is the chaplain, so he wanted to come in and say hi." And my dad got that twinkle in his eye, and he just boldly says, "I want you to know I have committed many, many sins." And I'm looking at him and I'm looking at the chaplain. I'm going, "What?" I look at the chaplain. He's been married for 75 years. He's a great dad. I don't know. I'm like going, "What?" And then I look back at my dad going, "All right, what the hell is this all about in my brain?" And he gets that twinkle in his eye and he goes, "But it's all okay because I have forgiven myself." And that was a good long debate Dad used to have whenever the Mormon missionaries came, or the Seventh-day Adventists, because he believed that we all had a little bit of God inside of ourselves. And so he really messed with them in a very constructive way. And so anyway, that was the last joke I ever heard him say. He was probably flirting with the nurses for a couple of hours before he went to sleep, and then he went to sleep. So that's a very good, happy memory for me. So anyway, thank you everybody for your very nice notes of support and encouragement. And I'm very excited about the rest of the year. We're going to have some really good icy stuff going on. So you stay in touch. Make sure if you're on Facebook, you subscribe to our page. If you're on YouTube, click subscribe and then click that bell so you get notified when I go live. All right. We're going to do a lot more stuff this year. So I will see you guys later. Have a good one. Have a great day. Happy Father's Day to every father out there, including our Heavenly Fathers. All right. Goodbye, YouTube. YouTube is done.